All right, I think we're recording. Mark, would you please make our motion?
Yes, I move that the items on the meeting agenda constitute essential business of this council. Meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans, considering the COVID-19 outbreak, and any rule conflicting with governor's executive order permitting electronic meetings be suspended.
Do I have a second?
I'll second that.
Thank you, Mr. Wendell C. Groves. Nice to see you. We have a motion and a second to conduct this meeting electronically. Abigail, would you please do a roll call vote? Would you all please signify by saying aye, whether you agree to or disagree with the motion? And if you have any conflicts of interest that you are aware of, please state those. All right, Abigail, take it away.
All right, Elena Boyer.
Present, agree, and no conflicts.
April Calvin.
Present, agree, and I work for the Salvation Army, which is an ESG and CoC funded agency.
Ashley Oswald. Not present. Ryan Ellis.
Present, agree, and no.
Alex Smith.
Present, agree, no conflict.
Michelle Hall.
Present, agree, and conflict of interest as I work for a CoC funded agency at Oasis Center.
Don Diener.
Present, agree, no conflicts.
Norman Humber. Not present. Catherine Knowles.
Present, agree, no conflicts.
Sheila Decker.
Present, agree, and my conflict is I am a contract vendor for Salvation Army.
Mark Overlock.
Present, agree, and I have a conflict. My wife works with Catholic Charities and they get money occasionally from the CoC.
Mary Catherine Rand.
Present, and yes, my conflict is that I work for the Mary Parish Center, a CoC and ESG funded agency.
Beth Shin.
Present, agree, no conflict.
Bernie O'Connell. Not present. Aaron Evans. Not present. Sandra Sepulveda. Not present. Will Connolly.
Hey, present, agree, and Park Center receives CoC, or sorry, ESG and Metro funding.
Paula Foster.
Present, yes, I agree. And my wife works for Nashville Cares, who receives ESG funding.
Laura Bermudez. Not present. Vicki Thatcher.
Present, agree, no conflicts. Gosh, that was hard.
Wendell C. Groves.
Present, agree, no conflict.
Jeff Gibson. Not present. Charlie Strobel. Not present. And Tom Turner.
Yes, present, I agree, and conflict is the employer. My employer receives ESG funding. That was hard, Vicki.
Did anyone join since we started the roll call, or did I miss anybody's name?
All right, then. Well, thank you all very much. Welcome to the Homelessness Planning Council's monthly meeting. Appreciate your time and you guys being here. Please remember to mute yourself if you are not speaking. Background noise can sometimes be a little annoying. Can you believe we've been doing this for a year now? How many of you are ready for us not to be doing this again? Raise your hands. Yes. Vaccines. Let's do it. All right. First thing this morning, as we all begin our day, is to take a moment of silence to remember those that we have lost recently in our community. I'm going to read those names and then we'll have a moment of silence. James Johnson, Dr. John Holder, Joseph Koshmitter, Jeremy Shivers, Brian Berkeley, Charles Birdsong, Jewel Copeland, and Lewis Jennings. All right. 60 seconds can sometimes feel like a lifetime, can it? A long time. Thank you all very much for being here this morning. I said that a few times. It just feels very much like after a year of doing this, it needs to be said that we appreciate how difficult this is for everyone. And we've all managed to make it through somehow. We have added something to the agenda of the last couple of months, and we're going to continue with that. It's a story of progress. One of the things that we realized is that we sometimes talk about all the things that our community is doing and things we need to do and how to do it, and sometimes forget to listen to what is actually accomplished. So we want to celebrate the positives when we can. And so, Judy, I don't remember who was supposed to do that this morning. Was it?
So it's in the executive committee, we decided we're going to do kind of a group. And April, if you can unmute yourself too and jump in. So I'm going to start. We're going to try to be conscientious and not make you use the person's name. I just wanted to remind everybody of that because a lot of us are aware who that person is. So let's just be conscientious of that. It's easy to slip the name. But it's pretty much a person who has been in the downtown area, living on the streets and on a bench for years, for about 10 years, basically. All of the community knew her. We have received in our office multiple complaints about why isn't anything done to help her. And we've had in the past years with providers coming together to kind of really coordinate who has the best relationship with her, how can we help, and just nothing really worked. It was always this barrier of what can you legally do, an arrest is really not the solution, especially for somebody who really needs this desperate assistance. But there has been a breakthrough, and April, if you want to jump in and talk a little about, because the Salvation Army and the Downtown Quality of Life team and the Downtown Partnership have been key to keeping in touch and having that breakthrough. So. Thanks, Judy. Definitely, I would say it's been a community effort. I don't know of not any one agency that has not provided services to this individual, from Open Table to the Contributor to the Nashville Police Department, Mental Health Co-op,
probably Centerstone, and I'm sure Park Center. I could go on and on with name dropping. If I did not say your agency name, do not charge it to my heart, charge it to my mind. Well, the police department, the quality of life team, reached out to notify us that they were going to go and remove this individual because of trespassing charges that were placed on her from MTA, which of course all of these things went into play for life-saving measures, right? But as you know, any outreach worker in any diehard social service provider, of course, that does something to their stomach when you hear that someone is going to be arrested for trespassing. Anyways, I'll move on. So they asked us to go along with them, and Paula, don't laugh at me. Oh, okay. So anyways, they asked the Salvation Army outreach team to go along with them to help in this situation. And, you know, this individual sat on one or two of the MTA park benches for the last 10 years. And, you know, when we went down, you know, she was refusing to leave. She was not gonna go easy. And mainly because she has all of her stuff right there with her in tow. So she did not want to leave her stuff. And, you know, she needed medical treatment along with the mental health treatment. So we were able to convince her to leave with Mental Health Co-op and the police department. They took her to Meharry General, and she stayed there for maybe a week or two. Then she went to Mental Health Co-op for respite, and now she's in Middle Tennessee Mental Health. Well, of course, if you know any diehard outreach worker, her story is not going to end there, right? Her story does not end there. Some of our outreach workers began really intense, almost stalking, you know, background check, right? They were checking out that, you know, you can Google anyone now, you can Facebook stalk anyone, and, you know, Instagrams, all these social media platforms. And we were able to find her family that lives in Florida. And we sent them a certified letter. And the family called the next day after signing for the letter, and her mom's still alive. Her sister lives in almost a $600,000 home. To think that her sister has been living on a park bench for 10 years, heartbreaking. I can't even tell you the amount of tears and sobbing and wailing that went on in that phone conversation. They want her, and they want her back, and they want to know where she is. They want to know where she's been, and, you know, just long conversation. So of course, our outreach team is a part of their family now. When you think of success, our outreach team is a part of their family, and they're able to fill in some of the gaps. You know, she got her master's from University of Florida. She wrote a book that's called The Good Samaritan. She wrote a book, a children's book, A Good Samaritan. We're ordering the book, no doubt. It is available on Amazon. And she was actually a professor at University of Florida, and that's kind of when mental health issues started to overcome. And so for the last 20 years, her family has not been able to find her. So for me, you know, so going forward, they are actually going to court. They have a lawyer. They're trying to get conservatorship over her, get her moved to Florida to be closer to them. And I know not all stories end with just a happy story like this, but I want you all to know, had the community not come together, who knows how long she would still be sitting there, you know, while she was at the Meharry General. Her clothes had started to fuse to her body. And her scalp, you know, had some major things going on. So when you think of sepsis, and, you know, I'm not a doctor, so I can't even begin to go down that path, but just know that the community coming together and all of the agencies that were involved in helping this individual definitely saved her life, and hopefully added years to her life afterwards. So if I ever get updates, or, you know, if the family's instrumental in being able to come here to pick her up and take her home, I'll definitely give you an update on that. Thank you, Nashville.
Yay. Those are the stories that we love to hear. All right.
Can I just add to that?
Absolutely, Vicki.
that was success. It may not have meant housing for her individually, but it was a success because reuniting somebody with their family is it's so much deeper and more moving. So thank you.
Thank you. All right. Well, I kind of hate to go on after that, but it's time to do that. So, Judy, I think you're up with our Homeless Impact Division report for this month.
Yeah, and just listening to this, it really gets to me. And Vicky, you also had a good point. It's not about one way of housing. It's about connecting to community, and housing looks different and solutions look different for every person. But what it is about is not giving up on people. And I think one of the breakthrough was that once the person's last name was known, which it was really, really hard to find out. But I also believe that we looked at different type of resources as a community for that. Then, you know, some more investigation with the tenacity of outreach workers. And this is a moment to really, we cannot underestimate the work that outreach workers do and the heart that they bring into this community. So this is really bringing that home. And I'm glad my camera wasn't on. I actually had to wipe off some tears just thinking about what it truly means. And this is, there are some people that everybody says, oh, we can't do anything about. And it's like, no, we can. So very, very close to all our hearts, I know. Now going in, and I'm now making this shift. Laura Bermudez cannot be here, so I'm really gonna talk more about the strategic plan. I make my report very, very brief and then give it over to Rachel actually for the data report. But I wanted to send a message. So Hannah Davis in the mayor's office is back. She's our liaison. She was out, just a reminder, on maternity leave, and she's transitioning back in. And unfortunately, this morning she had a conflict she could not get out of. But next month, starting next month, she's going to be back with us, just to let you all know. And then Rachel, if you can take it away from here.
Good morning, everyone. Rachel CoC here, HMIS Administrator here at the Homeless Impact Division. So I have a couple of slides to share this morning. We've been kind of presenting about the different pieces of information that are in HMIS, and today I wanted to focus on street outreach data, something that we are really focusing on boosting, having more information to be able to report out on the amount of contacts and engagements and housing move-ins that our wonderful street outreach providers here in Nashville are doing. So I'm going to share here. Screen one. All right. So here I have some HMIS data from the calendar 2020 year, looking at street outreach projects in particular. So this is important because, as we know, we have our PIT count information on a typical year that gives us that snapshot of one night, but it's also very helpful to see over the course of time the number of unduplicated people served in a street outreach capacity. So based on our HMIS data in the calendar 2020 year, we had 1,450 people served by street outreach projects. That included 580 chronically homeless persons, 81 veterans, and 39 chronically homeless veterans. Also divided here by household type and age. So 241 of those were youth under 25. 1,362 were adults not accompanied by children. 11 were adults accompanied by children, and then 19 children with those adults. Also 47 in households with only children. Looking at exits from these street outreach programs in HMIS to positive destinations. So 28% of the folks who were exited from street outreach programs exited to a positive destination. That's 210 people of the 749 who were exited from street outreach. So with street outreach, with most of our project types in HMIS, we look at move-ins to permanent housing. With street outreach, we know that that is often the first contact and how people kind of enter in the system of receiving services. And so we and also HUD look at what we call positive destinations, which is basically anything other than the street or jail. So those positive destinations are what we're aiming for and working on collecting that information. So we do know that still this number is incomplete and are focusing on increasing our street outreach data collection efforts and are continuing to work with the agencies who receive various types of funding or maybe don't, and see how we can work toward gathering this information in a way that allows us to report out more regularly and not have to depend on that snapshot of the point in time count. So this is also from the calendar year of 2020, the known street outreach agencies who have signed a participating agency agreement for HMIS, their funding sources, and the number served in the 2020 calendar year according to HMIS. So most of these agencies are also entering their client information into the coordinated entry process, in addition to several listed here: Catholic Charities, Centerstone, Community Care Fellowship, Launchpad, Matthew 25, Metro Social Services, Nashville Cares, Operation Stand Down, Room in the Inn, Safe Haven, VA, Vanderbilt Homeless Program. All of those places and these street outreach projects are encountering folks experiencing street outdoor homelessness. And a lot of those folks have been entered into the coordinated entry system. And like Shanley and I have talked about in the past couple of presentations that we've been able to share, being able to measure those outcomes in a street outreach project in HMIS is super important. Coordinated entry is super important for prioritizing referrals and resources, but we also want to make sure to collect that street outreach data in HMIS. So like I said, we're continuing to work on strategies to make this data entry sustainable. A lot of these organizations, as you can see, received the ESG CV CARES Act funding, which has increased our street outreach data collection by a lot. But we are working to keep that going in the coming months and years. That is all I've got for this morning. I'd be glad to answer any questions if there are any, or otherwise I'll hand it back to Judy.
And I am good for this. So if there are any questions, please, this is the time to jump in.
Hey, this is great. Rachel and Judy, thank you. I just have a question. Do we know the exit rate for other interventions in our system, and like how do those compare to street outreach for like positive exits, I guess?
Yeah, so I have some, so for like rapid rehousing, for example, we collect that housing move-in date as well as the destination at exit, and we can look at that by project type. I have some street outreach data that I'll be sharing a little bit later in this meeting. But looking on a system level, we recently submitted our annual federal reporting of system performance measures of our HMIS data that looks system-wide at all project types, number of positive outcomes and returns to homelessness, things like that. So that's something we will be looking forward to presenting in a couple months, coming months. This is definitely just a small piece of the puzzle there.
Cool, thank you.
So we'll go on to other types of projects after being served by street outreach as well. A couple other hands set.
Sorry. So this is so important. And, we complain every year when we have the pit count that it doesn't begin to capture the amount of homelessness that we see in Nashville. That's partly because it's a one-night count, and it's partly because it's incomplete, and many more people are experiencing homelessness over a period of time. But if we don't capture them in our street outreach records, then it's very hard to show what the level of need really is in Nashville. Places elsewhere that claim to have complete by name lists of everybody experiencing homelessness really feel like they've got a handle on their problem. And we're never going to get a handle on our problem unless we try to make these counts more complete. And I think that's going to feed into a motion later to urge outreach to participate in our coordinated entry system.
Absolutely. And thank you, Beth, for bringing this up, because that's kind of our theme for today, to really, we as a team have done a big push at the committee level, and you will hear about that from the point in time and data committee about a motion on that, and then a little bit on that later. I can then follow up on what our next steps are that we're planning.
Judy or Paula, I don't know. We've got a couple people with hands in WebEx. Are we using that system, or should I just talk?
Go ahead, Freddie.
So, Rachel, thanks. I know we have just started kind of adding a focus on street outreach through the HMIS Oversight Committee. I know a lot of the work over the past couple of years had been generally getting us to the point where we could start doing secure data sharing on the one hand, but also start to look at participation and see data that kind of adds transparency. Do we know at this point, and we can obviously reserve this to a future committee meeting, but I think since we're discussing in a whole group with more provider representation at the table, are there known obstacles to participation? Because if I'm reading your chart correctly, those are all people who already have participating agency agreements, right? Those are all organizations that already have those agreements. And so were you suggesting that coordinated entry is happening, not the rest of the HMIS process in some cases?
Yes, so in a lot of cases, folks are entering their clients into the coordinated entry system, which kind of moves them toward that if they complete the VI stat and for the prioritization of resources and things like that, and gets them the ability to participate in things like the connector card program or being eligible for rapid rehousing, things like that. So the way HMIS is meant to be structured, it's coordinated, kind of exists like in the foreground in addition to all of these projects, program specific type projects like street outreach, emergency shelters, rapid rehousing, things like that. So since we haven't had this shared data and reported back, I think that we're still kind of doing some education to the community and the participating agencies about the importance of tracking that information by project type as well.
Got it. Okay, thanks. That's helpful. We'll continue to obviously discuss this as we bring it back to the oversight committee. But no, that was really good presentation. Thanks.
April Calvin, do you have a question?
I do. I just kind of had a statement, wanting everyone to be really encouraged by the housing efforts that are going on in the community. Jefferson Street, for outreach services during the height of COVID, had the environment or the living arrangements there had increased to 140 people on any given day or night. Now it's down to 35 when we go there to provide meals. And looking at ways to kind of continue to reduce that number so that we can, help the city do what needs to happen in situations like that. Not closing. I want us to always use words like housing people as opposed to closing encampments. How do we house the people? Also, War Memorial, there's meals that go on Tuesday nights. Normally there's 100 people standing there in line for a meal. And I have a picture of last night's meal and there's 15 standing out there. So the efforts, I know a lot of these efforts came into play with COVID CARES dollars. I want you guys to know that all agencies that receive those funds are doing the best that they can do and really moving the needle of those that are standing outside. Beth Shin can maybe speak to this, or Dr. Shin in this case, right? You know, some of our participants that we have moved or housed, you know, that's been under the bridge 20 years or longer, we have a before picture and we have an after picture of just 3 months. And it's almost where you can't even tell that it's the same person. Also, you know, what we're having to educate some of the outreach workers on and some of the rapid rehousing workers on is some of them have passed away once going into housing. And I know there's a lot of research out there on the toxic stress that builds up in your body. And once you find housing and you're reducing some of that, the disease of whatever it was, right, kind of takes over. So there's some really good successes. And even in a situation like that, where a couple of them have passed away, please know that they passed away where someone knew their name, they were in a place where they were safe, and they were not on the street. So I am really proud of the efforts that's going on in Nashville. I think there may be a couple of stories that may be 10 to 20 that may not be going so well. I don't want that 10 to 20 to overshadow the 200 that's been housed and they're doing great.
April, we're going to elect you as our HPC cheerleader. All right. Thank you. Judy, do you have anything else for us for?
Not on this item.
Is it time to move on to Susie, or do you have anything else?
Yes, let's move on to Susie.
Well, let's move on to Susie, who I thought was on vacation. Why are you here?
Oh, because I love work so much.
Welcome. Thank you for taking time for us this morning. Go ahead.
Sure. So now I'm going to the really dry and boring part after all of that exciting stuff. Just kudos to Salvation Army, the Downtown Partnership, the Mental Health Co-op, Colby's Army, all of you guys who are out on the streets working so hard. I'm proud of you. I'm glad to know you. I'm so glad to see Rachel's work showing complicated things in as simple a fashion as possible and from an HMIS system that is more robust by the day. So way to go, guys. Okay, and again, encouragement for all of you all to vote for the outreach initiative and those folks who are out in the streets being recorded in HMIS to the greatest extent possible. We are not going to know the fullest extent of the problem out there if we don't have outreach workers entering folks that they encounter into that system. So back to the Continuum of Care, dry and boring competition stuff. The registration was due in HUD's eSNAPS online application system on the 4th of March, and I did register our CoC for that opportunity. It wasn't required because there were no changes in our Continuum of Care application, but I always like to do it anyway. So that is in it. That does not mean the clock is starting to tick on that competition. It only means that we're claiming the typical Davidson County geography and intending to apply. The Performance Evaluation Committee, which is the local rating and ranking committee for the applications that go in for the Continuum of Care funding each year, has been meeting once a month, so has ramped up its meeting frequencies, and is starting work reviewing the scoring matrix for local applications that will be submitted this year. And at its meeting on March 17th is inviting all of the applicant agencies to come and present their take on the COVID effect on both their projects that are funded and their agency operations. In particular, the PEC, the Performance Evaluation Committee, is interested in knowing whether there has been any dramatic effect from the COVID on things like expenditure rates and project performance of those funded projects. And so it will be an interesting meeting to hear from those agencies about whether or not things in the past year have been affecting the operation of those projects. They are planning to add to the local application a couple of questions that have not been on the application before, one or two on racial equity or disparity as it exists within projects and how those the applicant agencies are addressing that. And then we hope to coordinate with the Standards of Care Committee as well to see if they can submit a couple of suggested questions to make sure that agencies are aware that the standards of care exist, and that they are attempting to comply with the standards that are in there on the Continuum of Care projects. And that is about it for the Continuum of Care. Thanks.
Susie, thank you very much. Do we have anything else from Metro Homeless Impact Division or MDHA at this point? All right, we have become so efficient at these meetings, it's a little scary. My understanding today is that Heather Dillashaw was not able to be with us, but Judy, did you have something else to share with us on the front of the CARES Act?
Yes, Rachel is gonna share with the latest data on that.
Thank you, Rachel.
All right, hi, me again. Okay, so we, on our Monday afternoon work group calls with the rapid rehousing providers funded by the CARES Act ESG CV funding, have continued to report our data summaries. So as of the end of last week, we've had 379 clients enrolled in these rapid rehousing programs, and 256 clients permanently housed by the end of last week, which is absolutely amazing. That's 64% of our total goal of housing 400 people. There we go. We've also been including some information to focus on racial equity and disparities, looking at the number of folks who have been permanently housed by this particular set of rapid rehousing programs so far. 75% of the white clients enrolled have been permanently housed, and 62% of the Black or African American clients enrolled have been permanently housed. We continue to want to disaggregate data by race as often as we can to kind of make sure we're paying attention to these disparities and bringing these up for discussion in our work group calls as well. Here, just a summary of some of the information that we're able to report on from these 9 ESG CV funded rapid rehousing programs. So 379 people who have been served, 187 of those people are chronically homeless, 232 are adults not accompanied by children, 55 are adults with children, 91 children are with those adults, and 40 are youth under 25. And of those who have moved into housing, 186 have been in households without children and 70 in households with children. Looking at the number of days from enrollment in these rapid rehousing programs to housing, a great deal of people have been able to move in very quickly in a week or less, which is absolutely awesome. 130 have, and the average number of days is 27. So we continue to move as quickly as we can to get folks into that permanent housing. Another piece of really great information to see is this length of time homeless. This is based on questions about how long people have been experiencing homelessness by the time they enter the program. And a great deal of the clients enrolled in these rapid rehousing programs have been experiencing homelessness for over 2 years. So we like to see those people moving into housing just as quickly as possible. Folks are also beginning to exit from these rapid rehousing programs. Folks are not exited until they end their receiving assistance from the rapid rehousing. But the majority of those folks have moved into permanent destinations at exit from the program as well.
Rachel, can I ask you a quick question as you're going through this particular slide?
Yeah. Yes, that's
the number of people served.
Yes.
55 adults with children and 91 children with adults. Can you explain that distinction for me, please? Because
yeah,
it sounds like the same thing, just opposite.
Yeah, so the adults in the households with children and then the children in those households. So in many of the households, there may be more children than there are adults. Does that make sense?
I see. Yeah, I see what you're saying.
Word weird.
Yeah, I figure out a way to clarify that because that just I wouldn't have assumed that the way it's written, but okay, thank you.
That is my last slide. So any other questions, I'd be glad to answer.
All right. Well, thank you all very much for that.
Hang on one second, Paul.
Okay,
I'm sorry, I was late with my hand there.
Okay, go ahead, Freddie.
Rachel, and maybe this is a question for Judy too. I know we've kind of been looking at this as the surplus ESG through CARES. I guess there's been kind of a conventional wisdom that it has a 2-year horizon. I don't, obviously this whole program materialized after we developed our strategic plan. Are we going to update that, or do we have a sense of what is going to happen when we reach the end of that time period to prevent kind of a relapse where we don't have this level of funding to support people being rehoused?
Yes, we have discussions right now, very intense with MDHA. So MDHA has gotten 100 additional Section 8 vouchers this year. It's a one-time allocation. And then we're really looking at reinstating the up to 18 Section 8 vouchers on a regular basis. That's what we're pushing for, for people experiencing homelessness, looking at shelter plus care vouchers and VASH vouchers and prioritizing who needs what. Our goal is to intensely also work with the providers of rapid rehousing to identify people and get them signed up. Use rapid rehousing pretty much as bridge housing for the people that need the ongoing subsidies. And we're in discussions, and Heather Dillashaw is really instrumental helping us also work through these discussions on how we can do that to make opportunities available and really make sure that the case managers understand what those opportunities are and work on those. Frankly, if somebody gets, for example, a Section 8, ideally a little sooner, then that could free up some rapid rehousing dollars at a more limited basis for somebody else, so that's kind of we really focus on sustainability. That's a worry that all of us share in the community. So that's what the focus is. And really in the new year, that's where we shifted. From a resource development standpoint, as you know, we started the Resource Development Committee to look at what opportunities are. We really need to get a better handle on knowing where the resources, how we deploy them in kind of a big stroke picture in our community, to look at where these opportunities are to continue. And what we can tap into, especially for the ongoing support services. So it is a concern. It's something we're looking at. It's some discussions that we're having at the different levels. We continue these weekly rapid rehousing check-ins and education pieces. Every Monday we have with the stakeholders and providers these meetings. And then you're gonna hear in a little bit, we're also looking at doing the same for picking up outreach coordination and outreach meetings and planning those out as well. So we really have more stakeholders meetings where we regularly have the community and the frontline staff informed of what's going on with these strategies and focus.
Thank you, Judy.
So this might be a good time for me to ask for input into suggestions for the Affordable Housing Task Force. I put on the table and to get shot down that MDHA should double our allocation to 36 vouchers a month for folks experiencing homelessness, and should reserve all MDHA funding for people below 30% of area median so as to prevent the most homelessness. I don't imagine that's what's going to come out of the Affordable Housing Task Force. We just put in proposals at this point. But I would welcome other thoughts about what you all think we should be asking of affordable housing in Nashville.
Beth, I'll throw one quick idea on the table that has come up through the Envision process. I was surprised at both Envision Napier Sudicum and also Envision Edgehill that there was not an intention to do better than 1-for-1 on affordable units for low income affordable. And I think the Envision process should look at a target of higher than 1-for-1.
Hey, Paula,
Yeah, go ahead, Mark.
want us to pay attention. I know on the agenda, it says CARES Act grants. This new $1.9 trillion legislation that theoretically is going to pass the House of Representatives today has over $500 million that's going to FEMA for emergency food and shelter. It'll pay 1 month's rent, mortgage assistance, 1 month's utilities payment. Also, Freddie, for our purposes with Metro, it also has, I believe, $10 billion that'll go to local governments for crucial capital projects. And I'm wondering if you can use your influence to help us get that shelter that we've been talking about, 80 beds with the unit fully funded, and we get that to the top of the list. But I think from now on, we ought to have as a standing agenda item, at least for the next few months, this new act. I'm blanking on the name of it, but I think it's going to supersede the CARES Act, which is just petering out at the moment. Thanks.
Mark, just to clarify, are you talking about the permanent supportive housing project in downtown?
Yes, yes, ma'am. I couldn't remember what it was called. I'm getting old.
What happens when you retire? All right. Anything else on that front, folks? Questions and comments?
I don't feel like I can let Beth's question go by without saying something, but I might need more time, but I appreciate you asking Beth for input. I think that's a really important topic, and I feel like it's an opportunity for this body to, to weigh in on it, just even if the chances of something coming out of it are low. I remember when we asked for those 18 vouchers, we did some sort of calculation on the turnover rate. It might be helpful to go back to that calculation to see, like, I don't know how many tenant-based rental assistance vouchers we even have right now in the community. So just kind of like, if that's grown, then maybe we can ask for more than 18, or I don't know what that number is, but maybe some work around that would help. I don't know the status of the community development, all the funds that are in the community development department at MDHA, but it seems like, I know some communities have used CDBG funds, for example, to provide more insensitive supportive services for people that are living in housing. And I know that, like, a lot of it's a struggle for all of us to find funding for services for housing stability. So once somebody gets into housing, how do we, come by? Do we have enough funding to come by every day, every week, every month, depending on what the person needs? And so maybe not just to put all this on MDHA, but maybe MDHA could help identify funds that historically have not been used in that way. Anyway, those are just a couple of thoughts.
Thank you, Will. If other folks have thoughts after giving it a little thinking time for Beth in terms of things to take to the Affordable Housing Task Force, please send those to Judy. We can't, as a body, we are not to deliberate directly with each other, but send those to Judy. Judy will get those suggestions and thoughts to Beth as we go forward. I will say, Beth, that one of the things that I think we all know is there's an inventory issue. And we can ask for more vouchers all day long, but we don't have the inventory to put people in. The vouchers don't do us any good. So it's a conundrum, and I'm very, very happy that you are representing this community on that task force, because I know you understand it. So thank you so much. All right. Heather Dillashaw, I saw you just joined us, and we just finished talking about your stuff. So you have anything else you want to add to us before we go on?
I think the only thing I would say is that the landlord engagement team is working on the inventory piece. I don't know if Judy or Abigail, y'all talked about that earlier, but we're adding a staff person at IMHED to help ramp that up. I think there are going to be opportunities with the landlord incentives that we're working on as well, so that we can open up more units. If we now have cash to put in landlords' hands to incentivize them to do fair market rent rather than private. If we can get cash into their hands, then that has been successful in a lot of other places to getting folks to sign on. So I think that we will see some movement with the units over the next few months, which is definitely what we need. I think that Beth, to your question about MDHA and the vouchers, I think with the new vouchers that are coming from the new stimulus funds, I think we have an opportunity to push that question to increase that set aside, because there are going to be new HCV vouchers coming too. In addition to the 100, that Judy talked about, that's the one-time allotment. There's going to be additional vouchers coming to everybody across the country. So I think that is a good leverage point to push that double amount, right? Say to 36 or whatever it might be. And yeah, so I think that's what I'd say is all that stuff's in motion, and I think we'll see some movement over the next 2 to 3 months, including some very public statement from the mayor's office for folks to get on board with the landlord piece, which I think will be a big help too.
Thank you, Heather. That's all really good to hear. All things heading in the right direction. Anything else for Heather at this point before we move on?
Nope. I think Treva has her hand up.
Treva, do you have your hand up? Sorry, I didn't scroll down to my box.
Yes, can you hear me?
Yes, go ahead, Treva.
I was just going to address one of the comments that Will made regarding the CDBG funds for the supportive services. That is an eligible use. Unfortunately, the amount that we could use for that is capped at 15% typically. So it wouldn't pay for a lot of supportive services because we can't, again, the funds that we can use for that is capped at no more than 15% of what the annual grant is. That category is considered a public service category, and that's where we fund the rent deposits that we use for homeless, for the vouchers, and for Judy and NIM and stuff like that. So just a response on that funding source is limited.
Thanks, Treva. Hey, Treva, how much is 15% of our allotment? Just curious.
Well, actually, I'm looking at next year's numbers, and 15% is right around 800,000. So again, there's several, we fund our summer youth programs out of that and things like that too. But that, I mean, if all of it went to supportive services, that would be typically the most it could pay. So that wouldn't pay for a lot of stuff.
David, thank you very much for sharing that. Have any other questions for around those things? All right. Laura is not with us. Judy, were you going to do something with strategic planning at this point? Or
Yes.
Are we moving?
Yes. So I have the ability to share my screen, and I'm going to actually share it and try to show you a video real quickly to set the tone. So as soon as I'm playing this, if it doesn't work, somebody needs to let me know.
Okay.
It's a scandal that nationally we're spending more than $12 billion on a broken reactive system. And I think job number one, in addition to all of the imperatives that you've heard here, is to get to work spending the money that we're putting into this issue in ways that actually deliver results for people who are suffering. That's why having very clear goals at a community level, moving beyond programs to what is it we want for people. We don't want people to be experiencing homelessness, and pulling together, and this is really an accountability challenge more than it's a money challenge, pulling together that intention at the community level to know everyone by name, to work toward outcomes, and to continue working until we are not seeing people experiencing homelessness. This is not an unwinnable fight. While there are 568,000 people, as you quoted, at least experiencing homelessness on a given night, and 568,000 people too many, This represents less than a fraction of 1% of our population. This part of housing insecurity and housing injustice we can solve. And it's homelessness is such a powerful way into all of the questions and all of the issues that people have spoken to today. And getting our systems right, taking responsibility and accountability for a just resolution to this issue by using the money we have in ways that get results is part one.
So I wanted to show this because it was really important to me to set the tone on what we're doing with strategic planning, and what our responsibility as the governing body of the CoC is. So I'm trying actually. We had Laura and I prepared a committee meeting, a chair meeting with the committees. And we had that, I think about a couple of weeks ago, and we didn't get through. So we're going to have a follow-up meeting in April with all the chairs. But one of the things we did is really focus on the strategic plan. Everybody introduced themselves. I think the chairs really are trying to find ways how they interconnect with the committees when they have overlapping tasks that they're working on, and it really comes out and came out in that meeting how active and how proactive the committees are right now. They're really working hard, and it's nice to see. And we really focused back on the strategic plan and where that is. So what you see here on the slide is what you have in your strategic community plan. I actually encourage all of you to have it printed out and with you at all these meetings. And just once in a while that you know what's going on, or if you reference it, you have it actually next to your computer, that would be fantastic.
Hey, Judy, just to make sure I'm understanding, what I'm seeing right now is a blank gray screen.
Oh.
Me too.
Uh-oh. Let me stop sharing and trying this again. No, I
could print that up, but it would probably just confuse people. There we go.
There we go. So I'm not going to read the vision, mission, and values, but these are the things that we went through. And one of the things that was really interesting and an exercise that we did in depth and took our time is to go through the values, and we will report back to the Homelessness Planning Council what the outcomes were with the discussion with the chairs on going value by value and having a discussion how the chairs think we're doing in our CoC with being housing focused, person-centered, data-driven, committed to the effective use of resources, and race equity focused. These are the things that it was an interesting discussion, but it also was where we actually need to follow up and continue our meeting. The other thing we did is go over grounding what this strategic plan is all about. It's 4 goals. 1, to optimize all resources, look at what we have. We need to know what we have to know what we don't have. And we need to know what we have to know how effective we are in deploying our resources. Goal number 2, improve the data. That's what we are talking about, what we just started talking about at the start of this meeting. It's like really looking at where and how can we improve the data collection overall. We've done a lot of work and a lot of progress this past year in AGNS. Does anybody hear the music? Is that from me? Goal 3. So, sorry, I'm again having to stop this and see if I'm the one. Okay, it was me, so I apologize for that. That's what I get for trying to be technical and actually share a video with all of you. One of the goals, the 3rd goal, is really about enhancing and expanding the formal collaborations that we have. So really going to what does it mean and how do we interact with each other. It's really building those relationships in an ongoing manner. And the fourth goal is develop commitment through engagement. That's about the communications piece. The next slide is really, that is where we really focused on how do we as a community think about the strategic plan and how it's building up. So COVID has really disrupted our strategic planning process and progress and the timelines. And we really stressed with the chairs, and I want to stress that with you all, that we shouldn't focus on year 1, year 2, year 3 right now, but focus where we are in the strategic plan and really how do we get these phases done. This phase 1 is really looking at the establishing that system of resources, identifying what we have, establishing the data sharing ability and HMS bed coverage and coverage, improve the data collection, define the roles of governance. And then phase 2 is looking to expand this inventory and build up on that. And when you look at that as phase 1 and phase 2, all of a sudden it makes sense. We need to do the first year what we had laid out and really look at that foundation buildings that we can build up on. And then phase 3, the last is really maximizing inventory. It's like, let's do better with what we've started. And also in phase 3 is actually where we look at the next reiteration of a strategic community plan. And we hope by that time we have a lot of established system. We know what we have some more data that we actually can have specific goals moving forward in strategic planning. And then when you look at the communications piece, that is really across all of these phases. So this kind of slide, I think, is the key to remember as we are moving more and more, focusing more and more on what we need to do in the strategic planning progression and building our foundation so that you as the Homelessness Planning Board can actually do that accountability. So just to recap real quickly on what some of the things that Roseanne Haggerty said in the clip that I presented. Roseanne speaks about having very clear goals at the community level, how important that is. Moving beyond programs to what it is that we want for people. And what we want is ending their experiences with homelessness. And then also creating an accountability system at the community level. And she listed how to do that. It's know everyone by name, work towards outcomes, and to continue working until we have a system that ends homelessness. So it's really keeping that focus in front of us. And to me, this clip really spoke closely because as the Homelessness Planning Council, you are the community board to create this accountability. And I think with our strategic plan focus, I just wanted to bring it all together. It was very helpful to have these committee chair meetings and set the tone there as well. And so that's kind of the update on where we are with the strategic planning focus and how we're gonna continue to bring that back home, and work with the committees to really look at where that foundation is and build that foundation. And that is my presentation. If there are any questions, that's where we are.
Thank you, Judy. Do we have any questions or comments for Judy? All right, then. Thank you for that update very much. We're going to move into our committee reports. Our first committee report comes from the Point in Time Committee and the Data Committee. And I believe it's either Jaha. Thanks for coming today and doing this for us.
Good morning, everyone. So I will be presenting for the Point in Time Committee. And just to give you a brief overview of what we have been doing, since, of course, as everyone has discussed, we were not able to conduct the normal point in time count. And so some of what has already been discussed, I just want to highlight those things, is that what the committee decided once we received the exemption to do the point in time count as normal is that we really looked at how we can still make sure that we are reaching those who are experiencing homelessness, particularly on the street, and how can we ensure that not only are we counting those folks because, but we want to make sure that they are connected to resources and that we are able to service them as best we can. And so what happened is we looked at doing an aggressive outreach effort. And so that meeting stemmed from the Point in Time Committee. It was held in early February. We created, Troy, actually with the Metro Homeless Impact Division, created a Google document that has been created and is circulated with outreach workers. And the purpose of the document is so that we can track where outreach is being conducted, not only where we are doing the outreach efforts, but also identifying where there may be gaps, overlaps, or we see that there's a better need, or how do we better serve those who are in particular areas. And so the link has been circulated and we continue to review that. We don't have an upcoming meeting, which I realize we need to schedule. But the point of doing all of that is to really look at having a solid assessment of those who are experiencing homelessness, also figuring out what is the extent of the issue, as we talked about earlier, those gaps that the point in time count really does not capture. And then also an aggressive force to encourage agencies to participate with HMIS. And so the ask that the Point in Time Committee does have of the Homeless Planning Council is that we are recommending that the Homeless Planning Council strongly encourages all outreach groups to participate in data collection through HMIS to ensure that Nashville has a solid assessment of the outdoor homeless situation in Nashville. We are asking organizations with professional street outreach services to enter data into HMIS and coordinated entry, and to work with the Metro Homeless Impact Division to do so. And the goal is to be able to pull this first monthly street outreach report through HMIS by the end of April. And this report will show aggregate unduplicated numbers of people living outdoors, gender, race, age, length of homelessness, veteran status, income benefits, disability, etc. And so that is the ask of the Point in Time Committee and the work that we are doing. Are there any questions that you all may have for me?
Thank you, Jaha. Any questions for her?
This is Elena. I don't have any questions, but just some ideas of just kind of what the data committee is doing to also kind of help and support this effort. And we'll be having our meeting this Friday, but we're really trying to also accompany this ask with an FAQ sheet, frequently asked questions, to really help motivate organizations who aren't submitting to really, identify those barriers and try to get ahead of it in a supportive effort. So just wanted to add that bit in there. So we'll be talking about that this Friday as well. So it's a really important piece, like it's already been mentioned. So
thank you, Elena. Any other questions and comments?
One comment, we went to the Point in Time Committee, the Data Committee, and the HMS Oversight Committee, and they all adopted this ask from the Point in Time Committee to the Homelessness Planning Council. So it's 3 committees that have discussed this and all unanimously adopted this ask.
All right. So we have a motion from the PIT committee. Do I have a second?
Second.
Thank you, Beth. So this is a resolution basically that we are adopting to encourage community providers to participate in the HMIS program, getting folks in the street outreach program of HMIS. We will do a roll call vote on that. Abigail will take over for it. Please indicate your yes, no, or abstention when your name is called.
Elena Boyer,
yes.
Alex Smith,
Yes.
April Calvin, April Calvin. Come back, Session. Sorry, Beth. If you said it, I didn't hear you.
Sorry, yes, I didn't hear me.
Catherine Knowles. Catherine Knowles. Dawn Diener.
Yes.
Aaron Evans.
Yes.
Freddie O'Connell.
Aye.
Mary Catherine Rand.
Yes.
Michelle Hall.
Yes.
Paula Foster.
Abstain.
Ryan Ellis.
Yes.
Sandra Sepulveda.
Aye.
Sheila Decker.
Yes.
Tom Turner.
Yes.
Vicki Batcher.
Yes.
Wendell Seagrove.
Aye.
Will Connolly.
Yes.
Let me go back to April Calvin. Catherine Knowles.
I think April and Catherine went on a party hike together.
I see Catherine trying to unmute herself, but for some reason we can't hear you.
Sorry about that. All right. Motion carries. Thank you very much. Do we have a report from the Shelter Committee?
Hi. Oh, yeah. Judith, do you want me to report?
Yes, but just one thing, we're also working with, continue to work on the shelter data, getting that in. And I've been asking the HMS Oversight Committee to also help stay on top of that, where that progress is. And I've reported out on that as well. So it's not just the outreach effort, it's also shelter data. Thank you.
Yeah, and Judith does do that. And as far as the shelter committee, we met with the Standards of Care Committee, Judith and I did, to talk about how we might work together as committees better. And what we have decided to do is, and I believe that Michelle would probably report on this better, is the Standards of Care is going to work with the Shelter Committee and a couple of the other committees and try to get more input into how those standards are written. And so they're more reflective of the community, and that our goals are reflected in what we are actually working on is reflected in the Standards of Care. And so it's more of a working document, if that makes sense. And then we continue to work on the summer shelter options also.
Thank you, Kathy. Anything else around Shelter Committee? All right. We also have a report from our Youth Action Board, and Ashley Alexi is here to give us that report.
Yes,
Alicia, I'm
sorry,
sorry.
let me turn my camera on. It's gonna turn off. There we go. So the Youth Action Board, we have been working on connecting with Carrie from Oasis Center to establish a peer support network, really more of a peer support role, hopefully paid. That was something that during the YHDP process was something that was suggested in a part of the application for Oasis Center to get approved for for those funds. Me and another YAB member, we've also been a part of the Oasis Center's host home advisory team. And so that is going well. Michelle attests to how that's going, but we're definitely a part of that. The YAB has also talked about creating a resource list specifically for young people experiencing homelessness and maybe creating a navigation tool for that purpose. Let's see, our elections for upcoming roles will be held 2 weeks before the third year that the YAB has been, since the inception of the YAB, which was April 7th, but that Saturday will be April 9th. So the election will happen March 27th. For positions like chair or co-chair, secretary, note taker, outreach coordinator, and media. And someone will be taking over my role as co-chair. The YAB has also been a part of the Youth Action Society. That is a national collective of other youth advisory boards across the United States in various cities. It is hosted by the National Youth Forum on Homelessness and True Colors United. And those are monthly calls. Our next one is March the 17th. And that's basically what we have for the YAB. And that's all I have to say.
Alicia, thank you so very much for giving us all that information. And wow, has our youth advisory or action board been busy? And that is so good to hear. Thank you so very much for your service and what you've done. We appreciate it. Any questions for Alicia before we move on? Awesome. I don't see anybody's little hand up. And okay, I would also please like the record to reflect that Catherine Knowles is present and she was trying to unmute and vote yes on the above action item, but was having technical difficulties. So, all right. Moving on to other business. Does anyone have any other business or announcements or anything else that they would like to bring up today? Nothing? Wow. Another one of those days, right? Wait, I have a hand. Aaron Evans, did you have something you wanted to say?
Yes, ma'am. I joined a
Go ahead.
little bit late in the middle of the conversation about the outreach teams, and by way of action and thinking about something that I can do to assist this process. I know of outreach teams that are not, we're not on the list. And so I'm wondering, how do I affect getting them, gauge their level of interest and potentially participating, and who would I contact to kind of connect those people to potentially be one of the groups that is actually documenting information on behalf of Metro?
Yes, this is Rachel. They can, or they can reach out to me directly. And I have a new agency interest form to become an HMIS participating agency, and we can provide some more information and context to any groups that are interested. Thank you so much, Erin.
I appreciate that. Thank you very much.
No, thank you, Aaron. I appreciate that. And Rachel, you too. Great. Any other business or announcements? Ready?
Yeah, Paul, I just wanted to quickly mention that given that it looks like, having passed the Senate, the American Rescue Plan had a couple key things in it that are potentially of interest to people that sit around this table. There was $27.4 billion in rental assistance, $10 billion in homeowner assistance, $5 billion in Section 8 housing vouchers, and $5 billion in direct homelessness assistance. And so I don't know, Judy, if Heather or somebody else would be able to brief us, or if one of the national organizations is going to try to summarize this, but I think it would be important for us to understand as CoC and HPC what the impact of the American Rescue Plan is going to be for the work we do here locally in Nashville. But overall, I would call that very good news.
I agree, Freddie. Thank you. It is still, I believe, it has not, it's up for a vote in the House today. So hopefully after today, those things will be a reality, and the implementation is another story. But yes, going forward, more information would be phenomenal.
Yes, I will look and work with Heather to look for, there are some, by the way, the National Alliance to End Homelessness also has a conference going on. I forgot to mention that. It's really helpful if you actually go to their Twitter site and follow that. And on this note, Freddie, we're gonna see what briefings and information is out there, and I can forward it to the entire council.
Thank you.
And just from the National Healthcare for the Homeless Council, our policy team usually does summarize those. So whatever materials come in, we're happy to forward as well.
Yes, thank you, Elena. That would be wonderful.
Oh, and I guess it's worth noting that Bobby got picked up to be on the National Equity Task Force for the Biden administration, along with Dr. Hildreth. So we are very well represented in that community.
Definitely.
Yes, Elena, please extend our congratulations to Bobby for that.
Absolutely.
All right. Other questions, concerns, comments, announcements? Fun stuff. All right. Well, hearing nothing, I would then entertain a motion to adjourn.
Our motion to adjourn.
Thank you, Wendell. I knew you would. Do I have a second?
Second.
All right, second by Tom. Thank you all very much. Signify your affirmative by logging off. We'll see you next time.
Thank you, Paula.
All right, thank you.
Bye, everyone.